Welcome to the Muscle Research Review for the week of February the 9th. Quick research summaries for the very busy health and fitness professional. So let's get started. A new study asked the question, how effective are hip strengthening exercises for knee osteoarthritis? The study looked at a group of men and women. 37 were in the hip strengthening group, while 35 were in the leg strengthening group, performing exercises 3 to 5 times per week. The first 3 weeks involved supervised exercises, while the next 9 weeks were based on home exercises. The results were as follows. For the knee injury and osteoarthritis score and the Western Ontario McMaster Arthritis Index, there was improvement in both hip and knee strengthening, and results were similar between both groups. For hip knee range of motion and strength, both groups failed to show any improvements. Now, putting this into practice, we can say that for knee osteoarthritis, isolated hip and leg strengthening both improve knee pain, function, and quality of life. We can expand on this previous study by looking at a new review of the literature that asks what the findings are for the role of exercise for treating patellofemoral pain syndrome. In total, 31 trials involving 1,690 participants with patellofemoral pain were included in the study. Here's a summary of the results. There was very low quality but consistent evidence for exercise therapy and reduction of pain, improvement in functional ability, and enhancing long-term recovery. However, they couldn't determine what the best form of exercise was. There was also low quality evidence that hip plus knee exercises were more effective in reducing pain than knee exercises alone. The results seem to be consistent with what I see professionals doing in the field. They're basing their treatment strategies on the assessment and constantly changing it up if results aren't seen. They're also focusing more on the hip, among other areas, to treat the patient or client globally. How many of you see patients or clients with shoulder impingement syndrome? If so, here's a few things to note before discussing our next research study. One of the things we sometimes see with shoulder impingement is a superior glide of the humerus. This is often brought about by deltoid muscle overactivity and rotator cuff inhibition. There are a few different exercises that can be done to address this. That's where this new study comes in. The study looks at the activity of the shoulder muscles in 2 common exercise variations of shoulder external rotation, with and without slight abduction, in standing and side lying. That slight abduction is about usually 30 degrees. The study looked at 20 males with healthy shoulders. They performed maximal voluntary isometric contraction during the following positions: external rotation exercises standing and lying down with and without a towel. Here's what they found. With the towel exercise, there was no difference in infraspinatus and pectoralis major muscle activation. For standing towel exercise, there was greater posterior deltoid activity. The most interesting result was as follows. In side-lying position with the towel, there was significantly lower middle deltoid activity. The implications is that if we can get a reduction in middle deltoid activity, we may be able to reduce the superior glide during external rotation exercises. Although more research needs to be done, side-lying external rotation exercises with a towel may be the way to go when you suspect superior glide issues with impingement syndrome. Most of us use neck strengthening exercises on our patients and clients, but how long does it really take to see results? A patient brought up this question, so I kind of dug into a research study from April 2014. The study used high-intensity strengthening exercises for 20 weeks on those with neck pain. Basically, there were 4 dumbbell exercises: the front raise, lateral raise, reverse flies, and shrugs. And there was 1 extra exercise for the wrist extensor muscles. They monitored subjects' visual analog scale on a weekly basis. Study criteria was anyone with a VAS of greater than 30, and an average baseline was usually around 55. Here's what they found. Time-wise, change in pain occurred in 3 phases. There was a rapid decrease in pain compared to control group occurring during the initial 7 weeks. A slower decrease occurred from weeks 8 to 15, and a plateau was reached during weeks 16 to 20. Essentially, 4 weeks of training reduced neck pain significantly, but 15 weeks was required to achieve maximal pain reduction. Adherence to training followed a two-phase pattern. Weekly participation was about 70 to 86% in the initial 7 weeks and dropped to about 55 to 63% after that. Now, putting this into practice, we can educate our patients and clients that it takes about 4 weeks to see results, but 15 weeks to get maximal improvement. At the 7-week mark, we really need to start focusing on compliance. Do you use physical performance tests on your athletes? A 2-part study did a systematic review of some of these tests and broke it up into tests for the knee and tests for the hip, thigh, foot, and ankle. Here's what they found. For the knee, they divided the findings into 6 tests. The 1-leg hop for distance, the 6-meter timed hop, crossover hop for distance, triple jump, and the single-leg vertical jump. The 1-leg hop for distance is the most often studied. There was conflicting evidence regarding validity of the hop and moderate evidence that the hop test is responsive to changes during rehabilitation. Surprisingly, no test predicts knee injury in athletes. For the hip, thigh, foot, and ankle, results were a little bit more favorable. The 1-leg hop for distance and the hexagon hop showed moderate evidence for distinguishing between normal and unstable ankles. The medial hop can show moderate evidence in distinguishing between painful and normal hips in dancers. Surprisingly, the STAR excursion test appears to be the only test associated with increased injury risk. Now, what's your take on these results? Does this change the way you use these tests on your athletes? Leave a comment below. Also, make sure to subscribe to our YouTube channel to help you stay up to date on the latest research reviews. Thanks, guys.